Good morning and welcome everyone. My name is Audrey Schott and I work for the Montana Rural Health Initiative. The mission of the RHI is to engage partners to share ideas and expertise and to support communities in improving health while stimulating a higher level of wellness across the state. Thank you all for joining us today for the webinar Healthcare Grants Part 2 presented by Doris Barta. Doris Barta is the Director of Telehealth Services for St. Vincent Healthcare, a regional Level 2 trauma center serving South Central Montana, eastern North and South Dakota, northern Wyoming, and western Idaho. The Partners in Health Telemedicine Network, which is managed by Ms. Barta, was established in 1994 as a partnership of healthcare facilities and providers in Montana and Wyoming offering telemedicine, teleconferencing, and medical and community education. Ms. Barta has worked extensively in grants management for several years and has helped secure over $50 million in federal, state, and foundational support for healthcare initiatives including telehealth, trauma education and training, pediatric services, women's health services, and capital expenditures for healthcare development. Ms. Barta managed a grant writing team at St. Vincent for 12 years, managing a portfolio of over $15 million in federal, state, and foundation awards for St. Vincent Healthcare. Just a few technical details before we begin our presentation today. All of the phone lines have been set to mute. If you wish to unmute your line, please press *6. There will be a few breaks during Doris's presentation today for questions. If you would like to ask a question over the line, again, please press *6. If you would rather submit a question via the chat box, you may do that as well, and I will facilitate those during our question breaks. With that, we will get started.
Okay, well, thank you everyone for this opportunity to visit with you today and to discuss healthcare grants with you. This is the very first time I've done this kind of a workshop over a webinar, so I do encourage you to ask questions because I can't see your faces, so I don't know if what I am saying to you is making sense to you at all. We will have one break in the narrative of the presentation, which is about halfway through the various aspects of the grant that we're going to be going over, and I just saw that as a real great opportunity to separate out the narrative from section to section. So my first slide, we'll talk about healthcare grants, and I think this is something that you as an organization need to make a decision on, is if you are in fact willing to put the time and effort into pursuing federal or foundational healthcare grants. We are focusing on one specific federal grant today, but just in general, you know, is grant seeking and securing going to be part of your strategic plan for your organization? So I'm just going to step back a little bit and talk about what Victoria had mentioned in her workshop last week, and that is that it is getting more and more competitive in the grants arena. Just talking about the Telemedicine Network grants, for example. A year ago, they funded 80 grants, and this year they only funded 5. There's also a lot less money in your annual grants that we have enjoyed over the years, but they still expect the same level of performance out of you as they did 10, 15 years ago when they were given $500,000 a year for 3 years. So what I've seen over the course of the last 20 years is a lot of the funding initiatives are still there, but the dollar amount that they have to give is getting less and less. And so now the federal government can do one or two things. They can either give less grants, for like they did this last year with the Telemedicine Network grants, or they can give out about the same level of grants, reaching a broader audience across the United States, but giving less money per year. And so what I have seen in a lot of the grants that I have historically tracked and managed is that we are still getting some money, but the amount of money is less. The other thing that I've noticed over the years, and we'll go over the review criteria when we get farther into the proposal, is that there's a lot more emphasis on the outcomes of what you've been doing. And Victoria talked a little bit about that last week as well. The Office of Management and Budget is required to share with Congress the changes that are being made in the United States based on the discretionary funding that they have been giving out. And so what I've seen over the course of, I would say maybe even the last 7 to 8 years, most specifically, is that there's a lot more emphasis on your evaluation plan and less focus on the need, unfortunately. So what we decided, Audrey and Victoria and I talked about what would be a good grant to actually take a look at and walk through, and we decided to focus on the Office of Rural Health Policy grants. And the reason for that is because the ORHP grants are available to Montana because Montana is a rural and frontier state, as we all know, and they do have annual funding announcements. So even though you and your organization may have made a decision that there's a project that you want to pursue, and as you get into pursuing it and you find that maybe you don't have the time to put together a comprehensive proposal for this year, that there's a very good chance that that funding announcement will be available for you next year. So I encourage you to really take a look at what the Office of Rural Health Policy has. I think you can just go on orhp.gov or even HRSA.gov, drill down to ORHP and see what some of their funding announcements are as you start to look at what your potential projects you may be interested in pursuing for next year. David Iron, our foundation director here, calls grants Courage Capital, and I really like that that reference because I think that really is what it is. If you had all the money in the world to do what you wanted to do, would you have the courage to do that? And so grants give you an opportunity to have the courage to pursue some initiatives within your organization that financially would not be feasible without grant support. The other reason is that the ORHP grants are fairly easy to write. They have very explicit instructions on how to develop the grant narrative, and we will be going over that step by step as we move forward with this webinar. So this is a grant announcement that we are going to be reviewing. This one was due this year, or I'm sorry, last year. It is a telemedicine network grant program. We have several telemedicine networks in the state of Montana, and but don't get hung up on the fact that what we are going to be doing is going over a telemedicine network grant, because really what we are doing is walking through the grant guidance for an Office of Rural Health Policy grant. And what you will find is that each one of their grant funding announcements pretty much follow this same process of evaluation criteria. So although we are using a telemedicine grant as an example, it really isn't just an opportunity for us to walk through the Office of Rural Health Policy grants in general and what they are looking for in a proposal that you would submit to them. So how we will break out this section of the webinar is that we will walk through the introduction, the need, and the methodology. Methodology is one of the names for goals and objectives. Then we'll take a break and we'll answer questions that you may have on that. The reason I decided to break it right there is because your goals and objectives are the meat of your grant application. And that if you do not have clearly defined goals and objectives, then the rest of your application will be mediocre at best. Then we'll walk through, after the break, we'll go through the evaluation, the impact, the resources, capabilities, which is your organizational structure, the budget, and the technical capacity. So that's how we'll break out this narrative. So as we go on and you're thinking about questions that you may want to ask about impact or evaluation, just know that that's how we'll go over this. I want to also give recognition to a couple of my colleagues who, through their graciousness, have given me information about grants that they have actually written. Sherry Loney is the grants writer extraordinaire for Benefits Healthcare. She has written a number of successful OIHP grants. We will be using some examples out of some of the grants that she's written. Victoria Seck is also a grant writer who worked here at St. Vincent for several years. Some of the information in these narratives she has actually written, and then some of the information I've written. Everything that I am providing to you today is in a funded grant application. So, so just so that you know that this is what the federal government has looked at and said we value this information. So the next slide that we're talking about then is the funding opportunity description. That is on page 1 of the funding announcement. So the key words in this opportunity description in my mind are expand access, coordinate, and improve. Improve and expand, expand and improve. So you see there's a definite flavor to this, and what you will want to do then as you develop your grant application is to really take a look at the keywords that they use over and over again and make sure that you use that same narrative in your grant application. In this particular funding announcement, there are 47 pages to the document. It's very important to read the document through thoroughly for the very first time. And then after that, what you need to focus on is the review criteria and the scoring guide. Now, so in this particular application, and I wish I could have just got this particular document out to all of you. Most of you, I am hoping, are familiar with the Office of Rural Health Policy. It's interesting to me the way they lay out their grant guidance. So the guidelines for what the federal government are seeking in this application are on pages 17 through 24. And when I write these grant applications, I set that section on one right next to the other section, which is actually the scoring criteria that are pages 33 through 37. So pages 17 through 24 is just kind of an overview. This is how we would like you to write your proposal. This is information that you should have in your proposal to make it a fundable project. And then the actual scoring guidelines tell you how many points you get in each one of those sections. Now the scoring guidelines and the other part, the funding guidelines, they don't match up, and so it's very confusing when you're writing this proposal. Well, what should I follow? Should I follow the general guidelines or should I follow the scoring guidelines? What I've always told my staff is you need to follow the scoring guidelines, because I think, you know, in part, what you do is you write it to the scoring guidelines first, and then you make sure that you've got the information in that section that was also in that other in the funding guidelines. So it's kind of schizophrenic how you kind of have to write these proposals, but it does ultimately work. So in the funding guidelines, it first starts out and tells you that it wants an introduction to your project. But in the scoring guideline, it says nothing about an introduction. It goes right into the need. And so what we as an organization have done historically is we give you an introduction about who we are, what we want to do, and how are we going to serve the community. So we're St. Vincent Healthcare Foundation. We're submitting this on behalf of our telemedicine network. And then the other thing that the grant guidelines offer historically with ORHP, and recently I've seen that this isn't quite as true, but they historically have had administrative funding priorities and legislative preferences. You can get an extra 5 points in that grant application if you give them the administrative funding priorities that your grant application will be addressing and or the legislative preferences that your grant application will be addressing. Now, even though that may be apparent in your grant application, if you do not state it somewhere in the first part of your grant application, you will not get that funding preference. So we have just historically done that at the very front of the grant application. The other thing that I think that it is important for you to know is that this grant that you have had sleepless nights over, that you have worked on so diligently, that you have hundreds of hours in, will only get 2, maybe 3 hours of grant review. The reviewers will have a number of grants that they have to go over. The least I've ever had is 6. The most I've ever had is 14 as a reviewer. And it's my responsibility to review your grant and to score it as I see it with regards to the scoring criteria. That's why I've always told my staff, make sure that you write the grant to the scoring criteria, and then that you make sure that those other sections are incorporated into that grant as well. There are a number of people who review grants kind of as just a living almost. They go from grant review to grant review. There are a number of people who are reviewing your grant that know nothing about telehealth or nothing about your specific project. So it's real important that you do not assume that that reviewer is going to know what you were talking about. So you need to be use very simple language in writing your grant application. If your reviewer has to pull out their dictionary to read your proposal, I can guarantee you that your grant application will be scored down because of that. Now, if we were talking about NIH, that's a totally different subject. But for the Office of Rural Health Policy grants, it's real important that you follow their scoring criteria, because that is how your application is going to get scored. And if I can look at the criteria and I can look at your narrative and I say, yep, it's there, yep, it's there, yep, it's there, yep, it's there, then I'm going to score your grant higher than if I have to search through your proposal to find that information that I am responsible to score your grant on. So another thing that's real important is get some white space in that proposal narrative. It is really difficult for the reviewer to just read narrative, 12-point font, page after page after page, without any kind of break in the process that you're reviewing. So this tells the same story as, no, it doesn't mean that you replace it all, but that you can replace some of it. So if you look at this right now, we can say, okay, we do have critical gaps in pediatric care. There are only 178 pediatricians in the whole state of Montana. Look at what communities they're in, and 73% of them are located in the 5 urban communities. So you take a look at this huge state of Montana, and you see, wow, they really do have gaps in pediatric care. Now, that doesn't, as I said, it doesn't mean that you replace all of that narrative. You still put some of that narrative in there about access to care, the geographic area of the state of Montana. We have large geographic areas with rough terrain, all of that kind of language that describes our state can be written in that part of the narrative, and then give them some visuals to look at in the proposal. So also, in this particular section of the grant, in the need section, they want you to demonstrate specifically with data what the need is. So if you say something like, we all know the state of Montana is a vastly rural area that is primarily frontier with only one urban center in the state, your reviewer is going to go, so, you know, why are you telling me this? How do you know that? So it's real important that you give them the statistics related to the data that you are giving them that demonstrate your needs. So in this particular section here, this is a good way of laying it out. You've got your county, you've got your status, you know what date this information was developed and whether it's a HIPSA or MUA or MUP area. So, and so that's a table in the narrative. There's also then not only your rurality, your geographic area data, but also what are your other data for the population that you're trying to serve? What are the causes of death? What is your ethnic breakout for the service area? All of that is also very important. We wrote a grant application once where 1% of our population was African American. The majority of our population was either white or American Indian, which is our largest ethnic population in the state of Montana. But we got marked down for not mentioning what we were going to do to address the issues related to the black population, although there was only 1% of the population there. So different people focus on different things in your review. So if you have 8% of a population, you want to address what you're going to do that is ethnically significant to address all of those populations that you're serving. So this is just another example of how you can use some information to create some white space in your narrative. These are actual pediatric ER admits in Yellowstone County that were not hospitalized. This is helping us in this particular grant application to determine the emergency needs for care in Billings area for children who could possibly stay in their home environment. And that was what we were trying to address with this particular grant application. What we wanted to do is use telehealth to be able to help a rural facility keep that patient in their home community. This is some statistical information that helps us demonstrate that over these years, this is the number of children who came to our ER who were dismissed and not put in an inpatient setting, which means that it's very possible with the right scenario and the right training and the right kind of access to care that particular patient could have more than likely stayed in their home community. And that was what we were addressing in that particular application. So these are just some examples of how you can write some of the needs statements within your application. So now we're going to go to Criterion 2, which is the response in the grant in the scoring criteria, but it is called methodology in the funding announcement in that first section of it. So, so this is two sections of it, the goals and objectives and the benefits. So what are your goals? How will, and I have highlighted the impact on improving. Those were areas that I saw that would be real important for us to demonstrate in this section of the application. So they also want to know how you're going to collect your data and how we're going to improve access and how we're going to save money. What is the quality, improved access, improved quality. Those are real important areas for this funding source to have us demonstrate that we can do that. As you're writing your goals and objectives, you need to make sure that as you're writing them, you're also thinking about your evaluation plan, because your goals and objectives need to be measurable. And in order to, your evaluation plan will then utilize your stated goals and objectives in demonstrating that you have, in fact, developed a program that is measurable, that will improve access to, improve healthcare, improve quality, all of those things that you said you were going to do in your grant application. And then what are the benefits? What are the benefits to the organizations that you're serving, to the patients in those communities that you're serving? What are their benefits to the federal government, quite honestly, in improving access to care and improving quality of care? And those are also, benefits also need to be measurable. So the benefits, in my mind, kind of is staging your application towards your evaluation plan. So, what is your goal? What is the problem, and what would the world look like if you solved it? And a lot of people have a very difficult time developing their goals and objectives. They aren't really quite sure what you would consider a goal, and then what would be the objectives. So the goal is overall aim. You know, what is the purpose is what your goal is. So your goal may be to improve access to pediatric services in a rural community. That would be your goal. And then, so what are some of your objectives? How are you going to accomplish that? How are you going to address that? And then you get into, and I put evaluation here because a lot of times people will state that evaluation plan within their stated goals and objectives, and sometimes they break that out into a separate piece. But as you're thinking of your goals and objectives, it's really important for you to be thinking about how will I be able to evaluate this section of my grant application. So then there's the activities. The activities are actually your action steps. So thinking through the objectives and activities that will help you reach your goal, and start jotting down your budget needs as you go. This is important because your budget really does need to tie into your work plan. And your goals and objectives are the foundation of your work plan. So as you're building out your goals and objectives, this is what I'm going to do. This is the problem I wish to solve. This is what I'm going to do to solve this problem. And these are the activities that I am going to do to solve this problem. Your activities will need to be done by people, by assessments, by various using equipment. So that's when you start to kind of flesh out what your budget is related to your goals and objectives. So it's important to start thinking about how all those various pieces of this narrative, fit with each other as you develop your proposal. Now, these are two excerpts from two different written grant applications, both which were successful. So as you can see, they both wrote methodology, and then they wrote goals and objectives, or methodology and response. So what they did is they tied the two pieces of this grant guidance together, where one of them calls it methodology, the other one calls it the goals and objectives. So they make sure that you as a reader are saying, okay, this is this section, and this is how we're scoring it. So on the left-hand side, the writer reiterated what the purpose of the project was, and that is to offer pediatric care to children the ages of 0 to 18 in frontier communities. So that was the purpose that was identified in the very beginning of the grant application. It's reiterated here so that the reviewer has that in their mind as they start to go through the goals and objectives. So in the left-handed side, the applicant stated their goal is to provide pediatric patients in the number of communities that they were going to serve access to pediatric and pediatric specialty services. So this is very measurable. Okay, they're going to provide the service. They're going to provide it to 14 communities. In the objectives, then, this applicant went ahead and explained how she was going to do that. The first objective is to create an advisory group. She said who all is going to be in that group, so she's introducing the staff here. Now that will carry through into the work plan and into the budget. It's real important for you to know that if you are going to introduce anybody in your grant application budget, you better make sure that you have that person introduced somewhere in the narrative, and they had better be represented in your work plan. And we'll go over the work plan a little bit later. The reason I showed you these two ways of doing it is because neither one is correct. It is simply a style process. So in the one on the left, there's more of a narrative. She's telling your story a little bit more in the introduction of the goals and objectives. You'll see the abbreviated narrative then show up in the work plan that addresses these goals and objectives. But this gives her an opportunity to share with the reviewer who the people are going to be in that objective and how they are going to implement that plan. Then in the one on the right-hand side, it's more abbreviated. The goal is there, the specific objectives are there, and that then this writer takes the opportunity later into the grant application to more thoroughly describe the activities associated with the objectives. Both are very well done. So then the second section is the benefits. So what I did here is remember the first section, I think you got 8 points for your goals and objectives, and then the second section you got 8 points for the response. So the bullet points here, number 1, reduce costs. Number 2, increase access to care management. Number 3, patient outcomes. Number 4, increase patient family access to information. All of those specific things were bullet points in that benefit section of the review criteria. So what this writer has done is taken this review criteria and addressed specifically, bullet point by bullet point, those various sections that were highlighted in the review criteria that you must have this information in order to receive the maximum points. This kind of outline makes it very easy for the reviewer to say, yep, it's there, yep, it's there, yep, it's there, yep, it's there. And so then that gets a higher score, if it's well written, of course. The one on the right-hand side starts to talk to you about this is how we are going to measure our performance. So benefits, remember I said benefits is kind of your introduction to your measurement philosophy of your narrative. And so this individual started to talk about the measurement criteria and how they were going to show that this is beneficial to the applicant organization and their partners. So we are through the first 2 sections of the application, so we will stop here and take any questions that you may have, and then we'll keep going. Hopefully this is beneficial for you and is a good way for you to experience this webinar.
So Doris, we haven't had any questions come in through the chat, but again, if anybody has got a question out there and you'd like to ask it over the line, please press *6 to unmute yourself and ask away, or you can send one into the chat box now if you've got one. Well, Doris, I think we are question-free if you'd like to carry on.
Excellent. So then let's get right into the evaluation measures. So the evaluation measures have 18-point maximum. And so what they are talking about here is how will you evaluate your proposed work plan, your proposed stated goals and objectives. How will you make sure that the Office of Management and Budget can share your successes, your outcomes with Congress? And that's really what a lot of this part is about, is you said you were going to do this, you said how you were going to do this, now you're telling them how you will measure your outcomes. How will you make sure that you have created a successful product? And even if it's not successful, at least that, and I think that's important for us all to remember too, is that when you do your annual write-ups for them, that it's important to share with them what some of your challenges were and what some of the barriers were and why you may or may not have been able to achieve the goals that you stated for yourself. So in these bullet points, I highlighted the key words that I saw were very important in this part of the evaluation measure. Their experience and ability, specific data planned for collection, how to collect and provide the data, how to plan and carry out evaluation activities, how to modify the project if needed, and what is your dissemination plan for the information that you have gathered and the program that you have developed. So how will you know it works? How will you, as we stated, how will you measure your results? How will you demonstrate that the grant produced the results? Your applications will be reviewed based on the strength of the approaches used to measure your success in achieving your project goals. And this is one thing I think that it's real important. When I first started reading Office of Rural Health Policy grants, I think the evaluation criteria maybe was 5 or 10 points, and the needs statement in the grant was 20 to 25 points. Now we see the needs statement is a lot less, and I think it was 8 points for the needs, and evaluation now is 18 points. So evaluation is one of those things that it would behoove you to seek an external evaluator for. Many organizations do not have the expertise within their own organization to conduct the evaluation of their project. But there are people who do evaluations, and you can partner with them and pay that individual out of the grant budget to provide that evaluation plan for you, to do that evaluation. And you want to get that person involved with you from the very beginning as you're writing the planned project goals and objectives, because the evaluation plan is in an extension of your goals and objectives. So that person needs to be involved in the very beginning so that they understand what it is you're trying to do, and they can actually help you develop your goals and objectives, because they are going to be evaluating those goals and objectives on the back end. And so there are folks at the universities. We have used evaluators from the University of Montana, Montana State University, the Office of Rural Health here in the state of Montana. We've used evaluators from the University of Pennsylvania, the University of Washington, the University of South Alabama. We have used evaluators from all over the United States. So, your access is only limited by your imagination, in my point of view, into utilizing those resources that are available to you that aren't necessarily within your own organization. We have had to become very creative in the state of Montana because we don't have access to a lot of things. And so we've had to seek those relationships outside of the confines of the walls of our own institutions. So here are two sets of evaluation plans. In the first one, the applicant says who the consultant will be and what kind of evaluation they are going to use. They will use the logic model of process measurement, outcome measurement, monitoring, etc. And then they talk about the type of information that they are going to be collecting. Then they also talk about substantial data that they have also gathered through other funding sources through the Office of Rural Health Policy. So that helps them to demonstrate that they have the knowledge and capability. The other one, similar, they talk about process outcomes, evaluation, reliable measures, what they will do. This particular one is talking about the evaluator. She will meet with the director and the group. She'll develop a baseline data that the advisory group and the other staff will be important in that process. And then the types of tools that we will use to evaluate that particular grant, clinical and behavioral measures, and starts to discuss the various tools as an introduction to the evaluation plan. This is an evaluation plan then. So there's an introduction to the plan. This is our evaluator. This is our knowledge. This is our expertise. These are the kinds of things we're going to do. And then this particular evaluation plan here is developed against the stated goals and objectives of that particular grant. So if, as you may recall, when we talked about that first goal, that the providers and pediatric patients at 15 facilities and 14 counties or frontier sites will have access to these services. The first objective was an advisory council will be developed. Then we go deeper into how will we do this. This is our objective. These are our activities that we are going to do these activities that explain the objectives, and then these are our measurements. This is how we will measure that we have, in fact, done what we said we were going to do. These are process outcomes in this particular section of this evaluation, and then there will be other types of outcomes identified later in this particular evaluation plan. Evaluation plan needs a lot of attention. I would say it needs equal amount of attention as your goals and objectives. So don't cut yourself short on that development of your evaluation plan. Then we talk about the source data. Remember in the very beginning they said, well, where's your data? What kind of specific data are you going to collect? And what are your collection strategies and what tools will you use? And so that stuff is identified in the source data and the measurement section of that evaluation plan. This one is another way in which they identified their evaluation plan. One is done with a table, one has not. Once again, it just depends on your style, what you like to do, how you like to develop your processes, but at least all the information is still there. So this applicant highlighted the types of measures through indentation, and those are correlating the bullet points of the evaluation criteria of the grant guidance. So once again, this applicant has used the grant guidance in the development of her narrative so that as a reviewer, I can look at this narrative and I can say, yes, she addressed this, yes, she addressed this, yes, she addressed that. So all the pieces are there, and I can easily evaluate this plan. I can tell you as a reviewer, a lot of discussion historically has been around the evaluation plans. And so it's real important that you give that portion of your application the amount of time that it deserves. So after the evaluation plan, the next criterion in the funding guidance is the impact. You know, how will they impact the communities that they are proposing to serve? How will that application be replicable nationally? How will they disseminate information about their project? How will they tell people about the quantifiable and measurable outcomes for the quality of care, the efficiency, the cost savings, etc., that are important to the federal government as well as your organization when you implement this plan? And then sustainability. 8 out of 13 potential points are in your sustainability. How do you plan on sustaining this project after federal dollars? Is the project just going to dry up, or are you going to continue to move this project forward? This is real important, and a lot of your attachments related to your grant application are going to be your memorandums of agreement, your memorandums of understanding, your cooperative agreements, whatever you call them, with your project partners. You know, what is their commitment to this? What is your commitment to it? What is your partner's commitment to this project to ensure that this project is sustained beyond grant funding? This is another area that has over the last several years taken on a lot more important section of the review criteria. It used to be that you could just kind of use a boilermaker. We plan to sustain this project beyond grant funds by seeking other federal dollars, blah, blah, blah. You can't do that anymore. You really do need to develop a sustainability plan that the reviewer thinks is achievable. So in this particular case, the applicant on the left actually wrote a sustainability plan as one of their goals of the application to assure a sustainability of the project that they wrote. And so this does definitely address sustainability. Not only is it in their goals, it's in their work plan, and it's in their evaluation plan. So this is a very smart way of addressing sustainability of your project, is that they see this as a very important part of their goals and objectives of the project itself, is that they want to sustain this program beyond grant funding. The one on the right then, what I put up here was just what they shared about their impact. You know, how are we going to impact the community, and how are we going to disseminate information about what it is we are doing and how we are doing it. And so this one talks specifically about what our impact will be on the rural communities that we are serving. We talk about keeping the children in the state of Montana instead of sending them out. We talk about expansion of pediatric services in the state, allowing children to receive emergent and medical care closer to home. Now, it's also real important that you tell some stories, too, to really give validation to what it is that you are talking about, why it's important for you to be able to provide this type of service to your community. And that's that final paragraph of the application on the right-hand side, is that there was a child who was flown to Denver because he didn't have the kind of services that he needed in the state of Montana. Family had to, mom had to go with him, dad had to stay home and work. It disrupted the family environment. It disrupted the child's healing process, the parents, the stress, all of that related to having to separate out your family like that when you have to take your child 600 miles away for treatment. And so it brings the issue close to home, because we can all read this and go, this could be me. And unfortunately, some of us have had that experience where we've had a family member have to be transported out of the state of Montana for services, and we firsthand know that that expense on both financial and emotionally for our families in having to transport our services outside of the state of Montana. So then the next criterion is the resources and capabilities. Now this is 25 points. This is the largest section of the application, and it didn't used to be. So it's real interesting now, that they want to say, hey, do you know what you are doing? How can we ensure that you are knowledgeable about doing this? How can we ensure that this is going to be a successful project? So in this particular one, the Telemedicine Network Grant Program, they were only funding applications that had a proven track record as a telemedicine network. So if you were wanting to start a new telemedicine network, you were not going to score very high in this section of the application. These applications are extremely competitive. If you don't score in the mid to high 90s, you are not going to get funded. So if you've got a grant application that even scored a 92, chances are you're not going to get funded. So this is real important to make sure that you share as much information about your community and your network community, and how you are able to show that you have the resources and the capability to maximize this, to get this maximum 25 points. And now in the particular grant application, this is what drives me nuts, is they talk about the work plan in this section of it, but in the overall grant guidance, they actually address the work plan right after the methodology, which makes sense to me, because we're going to do our goals and objectives, and then now this is our work plan. So you have to be a little bit creative in how you kind of tie all of these pieces together and keep them organized in the flow of the review criteria. And I cannot stress that enough for you, that you want to make sure that you do keep this stuff in the flow of the review criteria, even though it may not make sense to you. Because when the reviewer is scoring, that's how they're going to be scoring. Now, if the information is in the grant application, they have to give you points for it. But I can guarantee you, if I have to search all through the grant to find it, I'm going to maybe ding you a point, maybe 2 points, because it was difficult for me to read your application. So make sure your application flows from criteria to criteria. Make it as easy as you possibly can for that reviewer, who once again is only going to be given your hard-worked grant maybe 2 hours of review. Doesn't seem fair, but that's the reality. So with this one, what I wanted to show you, this is the work plan of an applicant. And what they did here is they incorporated the evaluation criteria right into the work plan document. Now, remember, we had the other applicant had that evaluation criteria as a separate document. Either way is fine, but they both have used this table process to show you what our goals are, what our objectives and activities are, what our timelines are, and then this particular one incorporated the evaluation measurements within the work plan. This other work plan, they did not, because they had already given you that information in the evaluation plan. So this one, once again, you're going to see the same goals, you're going to see the same objectives, and you're going to see your activities then related to those objectives. Who are the responsible persons, and what is your timeline? So both applications give you that information. It's very specifically identified in the grant application review criteria that you need to have this information in your application. These are two ways to provide the information in the application. Once again, neither one is right or wrong. It's just difference in style. So, after the work plan, and I can't stress upon you enough either how important it is to make sure that you have all of your work plan information as it relates to your goals and objectives. So then the next section is the support requested. So the support requested is your budget. How realistic is the budget? How does it address your work plan? How does it address your activities? And is it realistic? A lot of people, and it used to be that the budget was only about 5% of 5 points. Now it's 15 points. So this is interesting that they've added a lot more point structure to the budget. A lot of times what I see when I do a grant review, it's almost like they have run out of time and the budget is not well developed and not well presented, and they lose a lot of points on the budget, where the budget can very easily give them you can very easily get all the points on the budget if you present it well. So the budget and the narrative should tell the same story. You should be able to read the text and estimate the cost. You should be able to review the budget and understand what's being done. And so those two, remember when I said start to jot down your budget as you're writing your plan? I should be able to, when I read your budget, it would make sense to me because you've already introduced all the players, you've already introduced the need for travel, you've already introduced the need for equipment, you've introduced all those various sections of that budget, you've introduced your evaluator, you've introduced all those sections. So, what is an allowable cost? This is really important because I've seen applicants write stuff into the cost section of the grant application that is not an allowable cost. So they end up losing money. So know your funding source. They will publish in the grant application what is allowable or not allowable. In this particular funding guidance, the allowable costs are identified in the funding announcement on pages 13 and 14. So they put a lot of effort into this is what we will allow as an expenditure on your grant. Fortunately, the Office of Rural Health Policy does allow operation costs. Some do not. For example, all of us who have ever applied for an RUS grant know they are equipment-only grants and they do not give you any funding support for your operations costs. Now, you can write them in your budget narrative as a match to show them that you've made this commitment and that you have the staffing plan in place to implement this project, but they are not allowed in your budget that you are requesting reimbursement from the federal government. The Office of Rural Health Policy does fund both operation costs and equipment, although equipment can only be up to 40% of the project budget. It's also real important for you to know what equipment is. For example, the federal government only considers things equipment that are $5,000 or more. And so if you are buying some medical peripherals, which you would consider equipment, and it's $1,000 or it's $1,500, you have to put that in your supply category. And I identify that as medical supplies. So you put that in your supply category. Now what that allows you is still for 40% in larger equipment costs, and then those medical supplies do not count against that 40%. So I've also noticed that funding sources can and will change their priorities. So it's important that even though last year they did it this way, you really want to make sure that you look at their new grant guidance and make sure that those priorities haven't changed. So what is an in-kind match? An in-kind is the stuff that you bring to the grant. It's the time and materials that you've already got into the grant application. Hard match is actual cash dollars. So in-kind would be, all right, Doris is already employed by our organization. She's going to dedicate 10% of her time to provide leadership to this project. Excuse me. Hard match is what we are going to hire Doris, and we're going to pay 10% of her time to implement this grant application, and this is done by our organization, and we're not seeking support from the federal government to do that. So it's also important for you to really read this part of the grant guidance, because they will tell you how they want you to present the budget. So if they tell you how they want you to present the budget, make sure you present that budget the way that they tell you to do it. You want to provide a thorough budget. You don't want to leave the reviewer guessing. And you want to provide a detailed budget and a detailed budget narrative. So what I do is I do an Excel spreadsheet on the front end of my budget and budget narrative that tells them specifically, these are the staff persons, this is the travel, this is the equipment, this is operations, all of those budget sections, and I'm lining out exactly the way they line it out in their 424 form, and I identify that for each year of the grant. So it's a 3-year grant. I'll do funding source year 1, funding source year 2, funding source year 3 on that, and then after that, then I will go into the narrative, which is page 2 of my budget, so that they have all 3 years laid out, and then they have the narrative, which is on the second page. So in planning for sustainability, you really want to avoid building salaries into the grants if you don't have to. You can show that as a match, but don't, unless you are hiring that individual specifically to run that project, you don't want to put them in your budget, because you want to be able to sustain the project after grant funding. And can your budget absorb the cost of the project after the end of your funding cycle? So that's a budget. This is criteria 7. It's the very last piece of this. This criteria is not in all grant applications. This one is specifically in the Telemedicine Network Grant Program, and that's because this is a technology grant. And so what they want to do is they want you to tell them how your technology, what technology are you planning on using, and how will it be integrated into your administrative and clinical systems. So are you using an open architecture? Are you going to integrate it into the provider's practice? Is it upgradable? Have you justified the technology that you've proposed in here? Do you have to have a Cadillac when Volkswagen will do? How will the project ensure patient and clinician privacy, HIPAA regulations? So you want to make sure that you address all of those activities. So these, once again, we have examples of how we have addressed this in 2 successfully funded grant programs. So in the one on the left-hand side, the applicant talks about their network. They've been funded since 2006 when they received an RUS grant. They tell you what they use. They use Polycom equipment, and who is their hub site for their network, that they're T1 connected, and that they receive USAC support. They talk about integrating it into the administrative and clinical information systems, and they talk about the equipment that they have. In the other one, what I am showing you is that they also did that on the first section of their application, but then they talked about this is the equipment that we will incorporate into our existing telemedicine structure. So they talk about the stethoscope, they talk about the general exam camera, and they talk about the otoscope, and very specifically detail what these items of equipment are that they are proposing in their grant application. That's the end of my presentation. I am open for any questions that you may have as a follow-up.